Robert and Cynthia waltz, like the dance. Initially, we moved from Austin here just about 4 years ago. And when I look for a doctor, I look them up and I go to different places and I'll look at their backgrounds and who they are and this kind of stuff. And I was doing something over on Santa Rita or whatever it was, street was. I saw this dermatology outfit up there. So I looked it up on the internet and I went through all there. And when I saw her picture, I said, oh, that's somebody I'd like to meet. And then I looked at her background and all that, and I found out that she had worked with one of the dermatologists I had in Austin. And I said, that's it. That's all I need to know. And so I called up and we got started. That's been, 3.5 years ago or so.
He really liked Tessa Cervantes. And he started, because he does have some, cancerous problems in his height. He didn't go for any of the beauty things.
Oh, I thought that was great.
That's what I'm interested in. And then when we lived in Austin, which has been now almost 4 years ago, I'd had a skin difficulty, which were some lesions that were precancerous. And I had that taken care of in Austin. And if I'm not mistaken, I believe that Tessa worked with one of our dermatologists in Austin. I'm just not clear about that.
Yes.
But at any rate, in the midst of all of this, I had some laser surgery in Austin. And I thought, oh, well, it's all just taken care of. And so we moved to Austin.
Moved to San Antonio.
We moved to San Antonio in order to be close to our son and daughter-in-law, because, boy, were we going downhill. I mean, you get in your late 70s and it's one thing after the other. And I was getting a little discouraged because I thought, I've got enough ailments. When I was 70, first I lost my hearing, and I miss it the most. Then I got lymphedema nobody really knew what lymphedema was. But I soon found out, got some physical therapists, got some rehab.
Talking about Tessa.
Mm-hmm.
We want to talk about Tessa.
Oh, definitely, because we had the laser surgery in Austin, moved to San Antonio. He needs to go to a dermatologist on a regular basis because he gets skin cancers in his head, numerous. And I tell you that Tessa, she gets a gun and she just zaps them. It's wonderful. He's fine. And he kept wanting me go see Dr. Cervantes because I was beginning to have some more symptoms of these lesions. And I am not one to run to the doctor. I was just going to ignore it till it went away. I learned that from my dad. Oh, it's going to go away. So, well, it didn't go away. And Bob, bless his heart, low key, because he knows I'm stubborn, he said, honey, why don't you let her just examine you? She is excellent. Bedside manner, extremely professional. You will really like her, and she will at least be able to tell you don't have anything to worry about. So his next appointment, which I did not have an appointment, but he did, and he said, come on, just go with me, just meet her. So we did. We came right here, and they took us back to this first room, and she's very attentive. She's very professional, and she focuses on her patient, and I was not her patient. She zeroed in right on Bob, did whatever she needed to do, and, come back in 3 months, we'll check it, la, la, la. And then when she dismissed him, she walked right over to me in this chair, and she said, now, what can I do for you? And I said, well, I'm not sure. I'm having the same symptoms that I had when I had a laser ablation therapy in Austin, got rid of all those lesions. But the symptoms came back a couple years later, and I was miserable. And Bob kept saying, "Don't be miserable. Go see Dr. Cervantes. You can't lose. She's really good."
Okay, we've heard that. Let's go on with this.
She's just so personable, and she looks you in the eye, and she's listening, and you know she's taking it all in. So she said she's put me up on the table, and she said, "I'd like to do some biopsies, but you're not a patient. Would you like to become a patient of mine?" Oh, absolutely. So she got her girl at the front desk, give Mrs. Waltz and I was
Registered you right,
I was a
registered you
little
right there and went ahead with the process.
I was a little nervous. So this precious little girl, not little girl, she's a grown woman and she works here. And she said, "Oh, I'll help you." So she gets this computer. And you know, people that are in their 80s, they know computers. We're not dumb. We know them. But when it's something different, so I don't remember who it was. Was it you, Haley, that came back there and sat down and filled out all the stuff? I don't remember who it was. It's been 2 or 3 years. But so Tessa came in. She took the biopsy, and it was all legal. I was all legal, her patient. We signed all that. And she said, "I'm going to send these biopsies off." And 3 days later, she said, "Well, some of those lesions are cancerous." And I said, "Well, you know, Dr. Cervantes, I went through this in Austin. There was not a dermatologist, gynecologist that's just focused on those two." And Tessa said, "I know there's one in San Antonio." She researched it. She found the one gynecological dermatologist in San Antonio, and her name was Corinne Jepson. So she referred me. It was quick because you don't want to mess around with cancer growing. So I went to see Dr. Corinne Jepson. Now she's a case. She's just adorable.
When I come here, you sit in the room. It's always been bang, bang. You're in. They meet you. Everybody's got a smile on their face. They like being here. And when you come in there, she comes in, it's no nonsense, all that. She'll look around there and say, "Oh, yeah." And I said, "Well, you do get paid by the shot when you freeze this stuff up here?" Because I've got quite a bit of them that go along. And she takes care of that. And then we talk a few minutes about what's coming up. And I also have another type of problem up here, which kind of grows on me, and you have to burn it off. You actually, just like a sunburn. And she'll do that to me every once in a while just to get things going. But the practices, they're here. They're always on time, and they treat you like a human being, and they treat you like a friend. And, grabs you and hugs you and all that, which I love. And it's a great place.
And I think a lot of people, women especially, come to a place called LIV Dermatology, and they're expecting spa treatments, the fillers, the whatever else I've never had anything done to my skin, but I want to. Well, they can do research on Dr. Cervantes. She has her Vita on the website. And if she has someone like me that says, "Just go one time and see what you think." I think she's brilliant. I think she's up on the latest and greatest of the newest technology. She will do cosmetic dermatology, which I'm also very interested in. And I didn't do it earlier because, well, I was busy. And now I've been retired for many, many years. And he stuck his foot in his mouth. He said, "You can do anything you want to do."
That's what I said. You can do anything you want here. But what I would say is you got somebody you're talking to, like I introduced my son and my daughter-in-law, they now come here. It's just you tell them what goes on. And the practice is fantastic. In this particular practice, you got two doctors that are a little bit varied in their expertise and what they do and it just works very well with the across the public. There's nothing they can't handle here.
Oh, I met Dr. this morning, and I talked to him about liposuction because have I got a flat tire around my middle? Oh, so I don't remember what the question was, but I went to Tessa because she's really smart. And she always focuses on you. And I might add, her office staff does too. They take you back, they ask what you're here for, and they actually listen. Oh, okay. Well, since you're right here, I'll go get Dr. Cervantes and we'll just see what we can do about that. And so when, and I haven't had any trouble since the laser ablation took out all those
Bad guys.
Yeah. And now I'm just coming because of other things, because I had a surgery in my hip a couple of months ago. And I also suffer from lymphedema, which is a dermatological problem. And I've had this for 11 years. But after the surgery, I started swelling up in both legs. So I went right to Tessa. She's managing that. And I don't think, I mean, this leg looks a little fat. This one looks fine. I've been wearing compression stocking at night and a little bit lighter compression during the day. And I just want to say that people think dermatology, especially one that's called LIV Dermatology, and it's so beautiful, they think, oh, they're going to do is run a spa. Oh, no. She does medical dermatology, acne, cysts, rosacea, a couple that I've had, acne when you're a little kid. Well, not little. She does medical. They do surgery. They do liposuction. Very skilled. And they're just very careful. And I wouldn't hesitate to recommend her. I come to her every couple of weeks now just to say hello, see how she's doing.
That's because she's helping you with your legs. We just all it could be is more accolades about what's going on here. It's just a fine place to come and do it. You get taken care of what your problem is, and if it's outside of their field, they point you in a direction that you should go, which is necessary.
Yeah, and does this look like a stereotypical dermatology patient? But he is. He's got all kinds of dermatological difficulties that have nothing to do with his wonderful handsomeness.
Oh, isn't that a shame?